So, facial collapse is when the bone that holds the teeth in place starts to resorb or disappear once the teeth have been removed or extracted. And this happens to everybody and it happens at different rates for everybody. But if you have a tooth extracted and you don't place an implant there, then you're going to have some element of bone loss, which can result in facial collapse. That means that the lower half of the face or the lower third of the face has less support. It sort of looks sunken in. You kind of have that Popeye look, for lack of a better term. Dental implants can provide a great solution or alternative because if a tooth is removed and an implant is placed, then it can help to preserve the bone and it doesn't resorb and it helps to maintain that facial structure over time. So when teeth are removed, oftentimes the bone starts to be resorbed within a couple months, certainly several years after the teeth are gone. And when you add pressure, that bone starts to resorb even faster. So if a patient has teeth removed and goes into a more traditional denture, meaning that there are no implants helping to hold the denture in place, that bone will be resorbed even faster because the dentures are pushing down on the bone when the patient is chewing. And then eventually the patient has less and less bone, meaning that the denture has less to grab onto to stay in place. If implants are utilized, two things happen. The bone isn't resorbed because it is anchored around the implants. Secondly, the implants allow something for the denture to be snapped onto or bolted onto, which holds the dentures firmly in place. So, dental implants are a great way to replace missing teeth, whether it's with a single tooth or with dentures. A lot of times, patients have been missing teeth for a long time, a couple of years, or even a decade or more. And with a 3D x ray, which we can take right here in our office, we can evaluate the bone and determine if they are still a good fit for a dental implant. In many cases, they are. Sometimes we can place the implant in the bone that they have. Other times, we need to utilize different grafting procedures or a sinus lift, but there are usually solutions, and a 3D x-ray helps us determine that and talk to the patient about it on the spot. Dental implants have a lot of benefits. They preserve jawbone when they're placed, and they allow us to replace teeth, whether it's a single tooth or with dentures that snap onto those implants or are actually permanently bolted onto those implants. This is really beneficial, not just so that the patient can smile better and smile more confidently, but so they can eat better. When a patient has teeth that they are able to chew with, or dentures that they're able to chew with, they can eat hard and crunchy food. They can eat salads and vegetables. They can chew meat better. And this is really important for overall health and longevity. And also, when a patient is recovering from an illness, it's important to eat healthy so that they can feel better as quickly as possible. And implants indirectly and directly make that happen. Dental implants are a great option to replace missing teeth. A dental implant can be placed about 3 months after a tooth is removed. We bring the patient in and we take a three-dimensional x-ray and a three-dimensional scan, and we marry those two images together to decide exactly where we want the implant to be placed so that it is placed in the best place possible for the best bone and also for an ideal crown to be fitted on top of the implant. The actual procedure is relatively quick. It's done under local anesthesia. So, just like when you get numb for a filling, and the patient's able to resume their normal activities later that evening or the next day. Occasionally, an implant can actually be placed on the same day as the tooth being extracted. This is a great option because it cuts down the healing time between the extraction and the implant placement. And patients are usually really happy with this option if they are a candidate. Many people think that the only option to replace missing teeth is something removable that would come in and out of their mouth, like a partial denture or a complete denture, but implants provide a really great alternative. We can do implants to replace single missing teeth, or we can use implants to hold a denture in place better. If the implants are used for a denture, sometimes those dentures would still come in and out of the patient's mouth and would essentially snap onto the implants. There are other options where the denture is permanently in the patient's mouth and is bolted down onto those implants. Either way, the patient can chew more confidently, enjoy their smile, and avoid using adhesive paste, which is a win for everybody.